Salem jewelry store owner Ralph Jackson is living pain-free thanks to his new hip.
Before, I had a lot of pain. I was bent over. I looked like I was 20 years older than I am. And now I'm able to not really worry about it.
Jackson had surgery in July 2011 and was referred to Salem Hospital's Joint Replacement Center of Excellence. Jackson vividly remembers his first day out of surgery.
Later that day, I was up and walking, and the next day I walked over 1,000 feet around the circle of the new complex up there. I marveled to my wife. I said, I know that it doesn't sound right, but I have no pain, and I had pain and the feeling of grinding before. And now, after the surgery, there's obviously no grinding, and it felt smooth and comfortable. My experience in there was fantastic.
We are getting them up a lot sooner and ready to go home a lot sooner.
Most patients go through a class 2 to 3 weeks before surgery and learn exercises to strengthen muscles for recovery.
Your brain gets used to doing them, so you know just what to do. You don't have to think about that in the same way as when you haven't done something. And I really, really think that helps.
Surgeons have performed knee and hip replacements on patients for decades at Salem Hospital. Physicians and hospital staff then worked together and made some dramatic changes in November 2010 by creating the Joint Replacement Center of Excellence with the specific goal of improving patient outcomes. Most patients now go home just days after surgery. The hospital encourages patients to work with a coach whenever possible who can be their spouse, family member, or friend.
We want them to come to the hospital, to come to the physical therapy sessions and get that hands-on experience. So it's giving them a little more comfort in taking their loved one home. They know the exercises, they know their precautions for our hip replacement precautions. So it's like another set of eyes and ears for that patient while they're here.
In its first year of service, the center helped 497 knee replacement patients and 283 patients recovering from hip replacement surgery. Patients receive care from a dedicated team of 4 orthopedic surgeons, 14 RNs and CNAs, plus 25 physical and occupational therapists and aides.
One of the patients we have this week is like, they said this has been like a hotel, not like a hospital. And she wouldn't mind coming back to us.
A lot of thought and planning went not only into the design of the center, but also the creative Traveling the Northwest theme for patient exercises. Betty Massoni is climbing Mount Hood, or rather learning how to climb stairs with her new knee.
I'm amazed that I'm walking so well, yeah, and able to do things like actually lift my leg a little bit and go up those stairs.
Massoni says she especially enjoyed her group therapy sessions.
It's really helpful to see how somebody else is doing, to see what's harder or easier. It gives you an idea that things are different for everybody, but you know, all of us making good progress, and you can kind of encourage each other. I have been amazed at how quickly, how responsive all of the staff, the nurses and the CNAs, have been.
As for the future, coordinators say the Joint Replacement Center of Excellence strives to continuously improve patient outcomes and welcomes input from patients.
I feel very, very privileged and honored to be in this position, and I'm looking forward to all the great things we're going to continue to do with this program.